So let's take a look at some exercising rules for each trimester. This is what I think you followed. The first trimester, you
Correct.
suggest walking?
Correct. So I personally, based on my experience, walking worked out great for me. There's some women who don't experience morning sickness. They may be able to continue exercising as they normally did, but walking for me, it felt great to get out there, get some fresh air. And in the second trimester, I like to avoid jumping. We're going to get into that a little bit later, and hyperextending and twisting type of motion. Also, as the belly starts getting bigger in the second trimester, it's a good idea to avoid exercises where you're lying on your back, as that can restrict blood flow. And then the third trimester, flexibility is my main goal.
Okay. Now, I've heard, doctor, and you could correct me if I'm wrong, but if you were a runner before pregnancy, an avid runner, you can run during pregnancy too. And that's what I did.
You can run during pregnancy, but I think once you get to second, third trimester, you're probably going to feel a lot more uncomfortable. And also there is a chance of, it depends what medical condition you could have.
Exactly.
If you have a low placenta or certain conditions that increase the chance of preterm birth, some of those exercises should be definitely decreased.
Okay, and what are some do-nots that one should not do when they're pregnant, doctor?
Well, I think one of the things that you described earlier, especially on your back, you're going to decrease your return of blood flow to your heart and therefore decrease the perfusion to the uterus. So those are one of the things that you try to avoid significantly during pregnancy.
Fantastic. We have some pictures of you doing your thing, which I love because I was such an avid exercise guru too. What are you doing here?
So I'm using a resistance band. The reason why I'm using this, it's a very lightweight piece of equipment. You could store it underneath your couch and you don't have to worry about, dropping it on your toes or, it's really safe equipment for pregnancy. What I'm doing is a kickback exercise, and this will help strengthen the glutes. Strong glutes lead to stable hips. And hips are, the name of the game with pregnancy, trying to get the baby in the right position. So that's an exercise that I'm doing here. If you look at the next picture, what you're doing is you're bringing your leg forward and then kicking it back with the resistance band.